Hello everyone, I am Dr. Kanika and I am a homeopath from New Delhi, India. I have been practicing homeopathy since last 10 years. I'm here to present my own experiences in positive psychology and how I integrated positive psychology with homeopathy to provide quality healthcare to my patient. My journey started when I realized that most of the diseases have stress as their etiology, means the causative agent. So that intrigued me more, and I started researching upon how is that possible that the stress is causing the disease. And I stumbled upon this beautiful field of health science, which is psychoneuroimmunology, which means how psychology affects the immune system and then it causes disease. So this presentation of mine is just a brief abstract of this vast field of science. And it is not the only field of science that is there nowadays. There are many field of sciences now which are actually researching on how emotions actually affects our body and causes disease. So my presentation will be on how psychology and its effect on immune system and the role of homeopathy. And it is not a recent field of science. In ancient time also, the ancient physician accepted that the human body is the center of physical mind and consciousness. Ibn Sina, one of the very famous medieval Islamic traditional philosopher, also affirmed that human body is the entity made up of mind, body, and soul. And this we are talking about in late 900s and 1000. He stated that unless we take all aspects of human body into consideration, the diagnosis or cure of any illness is not possible. His famous book is The Canon of Medicine, which is still studied in the Middle East by many of the physicians. It is still one of the curriculum books in many of the medical colleges in Middle East. The Hippocrates, the founder of modern medicine, also believed and propagated in holistic healing system. Norman Cousin, American political journalist, author, professor, and peace advocate, has also proved and advocated the effect of emotions on body. How? Because of his work, he used to travel a lot. So he developed a collagen disease called ankylosis spondylitis. And the only treatment which was given to him was painkillers, which is aspirin and phenylbutazone. He discovered that although the pain was okay when he was taking the painkillers, but he was not getting better. So he decided to take things in his own hand, and he actually took his blood test, and he realized that his vitamin C levels were decreasing. What was causing that decrease in vitamin C is that painkillers were actually suppressing the adrenal glands which are present on the kidney. There are small glands present on the kidney. They secrete a lot of hormones. So they were actually suppressing the adrenal gland for the absorption of vitamin C. So what he decided to do, he decided that I will take only vitamin C supplements on a daily basis. Okay. And he suggested that because of his physical stress and emotional stress, because of his work, because he used to travel to a lot of places, he said that my negative emotions are actually impacting my body, and that is why this adrenal gland of mine is getting affected. So along with vitamin C, what he did, another thing was, for 10 minutes every day, he used to laugh. Not just laugh by himself, but he used to watch TV, or he used to watch some television show, or something he used to do where he used to disconnect himself from his work or from the world. And what happened actually was his ESR rate actually reduced. ESR is erythrocyte sedimentation rate. This is an indication of any disease or any allergy in the body. And he actually saw that his ESR reduced only just by taking the vitamin C, taking proper nutrition, taking good exercise, and laughing. This is all written in his book, Anatomy of Illness, which is a very famous book which we study in our medical colleges as well. So it is now scientifically proven that humor lowers the cortisol level, which is the stress hormone level. It reduces the pain threshold, and it boosts the natural killer cell activity, it increases the physical stress toleration and overall well-being. This all will be discussed later on, but now it is scientifically proven that humor does all these things. So an understanding of the impact of emotions, beliefs, and thoughts will actually deepen the knowledge of physiology and pathology of human body. Each emotion actually result in the synthesis of different neuropeptides, which are capable of determining the probability of individual getting affected by the virus. This is how emotions are connected with disease. We all know the impact of nutrition in the body. Nutrition plays a very important role in maintenance of not only physical but emotional health as well. Nutritional psychiatry is a recent addition in the field of modern science, and it talks about intake of appropriate food containing right amino acid, which are the building blocks of life. From them, the mood regulating neurotransmitters are synthesized. It is also now proven that certain types of cancer affecting human being are manifestation of suppressive emotions. So, like I told you that I am studying the field of psychoneuroimmunology. There are many fields like epigenetics, psychophysiology, health psychology, biopsychiatry, psychoneuroimmunology. These fields are actually enabling the health science to appreciate the influence of mind on human body. Any injury that is to the physical body has an immediate impact in mind and consciousness. And similarly, any effect in the mind shows in the physical body. In PTSD, which is post-traumatic stress syndrome, the injury is to the physical body, but the mind and emotions come under great strain. And people who have PTSD are known to go for therapies for years long without getting any relief or without getting any consolation. But the PTSD is the physical realm and it affects the mind. Another is panic attack, where the mind is affected and it shows in the physical body by increase in heartbeat, causing palpitation, sweating, and tremors. So emotions, what are emotions actually? Emotions are nothing but a strong feeling that we feel, that any of us feel and experiences based on what circumstances we are in, what is our mood and relationship with others. There are two basic emotions. The broad category is love and fear, and all other emotions are like the branches of it. How fear affects our emotions? A very small and a basic example: when a patient is met with an accident, when a person is met with an accident, what happens? The body goes into emergency. In emergency, this adrenal gland, which I'm talking about, gets activated and it releases adrenaline, the fight or flight hormone, which is called adrenaline. This hormone helps in daily stress by reducing the blood flow to the gut and redirecting it to the muscles of the body to tackle tough situation. When somebody feels that they are being chased, so what happens? Their heartbeat increase and they start running. So what happens is this hormone is actually helpful. It actually protects us. When a person falls down, the person becomes numb for a few seconds, but then he gets up. So how it gets up? Because adrenaline, what this does, that it changes the physiology, the body physiology, by reducing the blood flow to the gut and redirecting it to the muscles. Now this is the physical stress that I'm talking about. What will happen if there is stress on a daily basis or on momentary basis? Every time a patient or a person is under stress, the adrenal gland will be activated to release this adrenaline. There will be reduction of blood flow in the gut. So this hormone will actually do more harm than good. A diabetic, it is known now, a diabetic who lives in constant fear or stress is more prone to diabetes related complication than the diabetic who lives happily. Same is true for people who are prone to diabetes, who don't have diabetes but they have family history or genetics. They are prone to diabetes. If they also live in constant fear or stress, they will get diabetes. Here what happens is adrenaline increases heart rate. Also, it stimulates liver to produce glucose in excess, because glucose is instant source of energy. So when glucose is produced, there is reduction in insulin, which is the regulating hormone for glucose, because glucose has to provide energy to the muscles. So the insulin is reduced and glucose increases. And glucose keeps on increasing because adrenaline is getting released. So what happens? The blood glucose level shoots up, which causes diabetes. The amount of adrenaline released in the blood stream depends on the impact of the fear factor. The greater the fear, the more amount of adrenaline. Now here I'm not talking about fear when you are scared. It's not just the fear of when you are scared, but it is fear of failure, fear of rejection, fear of what a person's image is in the society, fear of losing love, fear of losing money, fear of losing health, fear of success, and most recently, the fear or the stress in LGBTQ community. These people, yes, government have made some regulations for them, some rules for them, but still they are not able to come out to their family, to society. They are under this stress a lot. Now, how does love affects our body? Love actually releases the hormone which is serotonin. It is the most powerful organ that is released from our gut, heart, and brain, and brings the state of tranquility, serenity, and peace. Studies have actually revealed that serotonin is a potent accelerator critical to maturation of brain. It influences mood, sexual desire and functioning, appetite, learning, and social behavior. It is also responsible for milk production in lactating mother. Because serotonin is a potent accelerator critical to the maturation of brain, its deficiency is known to cause autism and Down syndrome. Another hormone that I want to talk to you about is PEA, phenylethylamine, which is released from the brain in the course of elated happiness, romance, and it is as effective as amphetamine, the most powerful narcotic which has taken over the world. It causes PEA, our hormone, not the amphetamines, but our hormone causes the release of dopamine or norepinephrine, two crucial neurotransmitters that regulates our mood and behavior. Endorphins, the endogenous morphine, which our own body synthesizes, is more effective than any opiates given for the chronic pain management in various diseases. Hunger hormone, ghrelin, also reduces stress. That is why people who are stressed are prone to obesity, because they compensate stress with food. Estrogen, the female sex hormone, and testosterone, the male sex hormone, are produced from DHEA, dehydroepiandrosterone. It is the hormone released from adrenal glands, gonad, and brains. And they are the main hormones responsible for a feeling called love. Love. This, I'm talking about the sexual love. Fear or stress reduces or shuts down the secretion of DHEA and increases the production of cortisol. So when DHEA is reduced, so naturally the production of the sex hormone also reduced. That is why over a period of time in marriage, due to stress, due to responsibilities towards family, toward their own family, towards job and everything, couples say that they have lost spark. Actually, they have not lost spark. They're actually, the fear is actually shutting down their production of sex hormones. Now, what is epigenetics? What is this field of science I'm talking about? Cell production is actually influenced by the external stimuli, which are called peptides. This peptides influences cell production by influencing DNA. The only way to change cell physiology is by changing the external stimuli, the peptides, which are the emotions. This field of study are called epigenetics. This is based on the study done by Dr. Bruce Lipton, where he says that receptors, obviously the cell is receiving information from outside. So obviously there are receptors in the cell. So these receptors are like antennas which senses signal that approaches the cell. These signals are in the form of peptides, which I mentioned earlier. These peptides bind to the skin receptor cell, then they influences DNA to undergo transcription and translation, which is the process of producing protein. So this is nothing but the transfer of information to DNA on what to produce, when to produce, and how to produce. Dr. Lipton observed that cell grew well in a vial where the medium was rich in nutrients vital for its growth. The nutrient was placed in one end and the cell culture was placed in the other. It was seen that the cell culture actually moved towards the nutrients. The opposite happened in the dish containing toxin, which retarded the culture's growth and it moved away. Now here actually the cell culture has an option of moving away. But what if the toxin is all around us and we are not able to go anywhere? We will succumb to it. The body will succumb to it. So cell grow in an atmosphere conducive for their growth. Psychological dwarfism is a condition which we have seen in many children, and they are seen in children who are brought up in an environment lacking positive feeling and those who are subjected to abuse, whether physical or mental. Negative hormone impacts the growth hormone negatively. Negative environment, sorry, impacts the growth hormone, and growth hormones is essential for bone development. That is why these kids are short. Glycogenolysis in their liver. That is why these kids have sugar, diabetes, and lipolysis in the adipose tissue. That is why these kids are prone to obesity and synthesis of new protein. Now, how and why these emotions are transferred? We know that the cell is able to receive this information. So why does it happen and how does it happen? So the study was done by Dr. Disbert, who discovered that peptides are the medium by which cells communicate with each other. The communication of cells are done by these peptides, and these peptides are nothing but the external stimuli. The cell receptors are the interface between emotions and tissues. The receptor is the brain of the cell that determines its behavior. These receptors are made of amino acid. So nutrition, amino acid, everything is related. The receptors are made of amino acid floating on the outer cell membrane area, waiting to bind with the peptide. The substance that bind to these receptors are ligands, are called ligands, and 95% of these ligands are peptides, which she will later call neuropeptides because these are synthesized in the brain. So Dr. Pert found out that high concentration of neuropeptide are found in limbic system and amygdala, where information from our five senses is relayed there. So these peptides, so the receptor of these neuropeptides were also found in the immune system. So the information from our five senses is going to the limbic system and amygdala. From amygdala, it is going to the immune cells, and from immune cell, it goes to different organs. So the receptor from the brain to the receptors of the immune system, then from immune system to the receptors of different organs of the body. Immune system is made up of spleen, bone marrow, and lymph node, and they contain receptors for neuropeptide of emotions. They have receptors for all the peptides present in the brain. Whatever peptide is present in the brain, the corresponding peptide is also present in immune system, and corresponding peptide is also present in all over the body and different organs. So immune cell and the brain are connected via this network of neuropeptides of emotion. That is what she called it. So the limbic system is a storehouse of emotion. It releases neuropeptides. It binds to the immune cells. So the immune cells release neuropeptides and it binds to the receptors in the organs. Now, how does these receptors know what to do? Do they have memory? Yes, they have memory. Each neuropeptide contains a set of information embedded in. So this information includes the data on what to produce, how to produce, and when to produce. This is transcription and translation. The DNA gets influenced by the external factor, which is called biomemory of the cell. It is a collection of all the emotions and memories encoded in each and every cell. Dr. Pert actually proved that the type and the number of neuropeptide available at the receptor site of the cell influences the probability of an individual falling sick or being hale and hearty. There are over 200 memories that are stored in body and brain in an area called ganglia, and these all memories are emotions driven. Emotion influences all the cell in the body in the form of peptide, which binds on the receptor of the cell. So she called these peptides nothing but the peptides of emotions, which now, as I mentioned earlier, that these peptides are synthesized in brain, And glucose is the fuel which is required by the brain to secrete neuropeptides. Since brain doesn't have glycogen storage capacity like the body does, body stores glucose in liver, in fat and other tissues, the brain doesn't. That is why hypoglycemia, when there is low sugar in the body, the brain is most affected, and hence it affects neuropeptide. That is why when there is low sugar, people feel dizzy or they feel disoriented. Different neuropeptide ligands produce different types of emotion. For example, endorphin, which I told you, is responsible for bliss and bonding. Oxytocin helps in bonding. And this is why a newborn infant recognizes his or her mother. Oxytocin is released during labor. That is how the child is born. Okay, now how immune system and emotions affect our body. Nowadays, the most common emotion that people are feeling is stress. In stress, people feel anxiety. They feel like they don't have energy. Their muscles are tense. The blood flow is disrupted. Their immune system is compromised. Studies actually show that people facing stressful situation on a regular basis. Now there is stress. We cannot remove stress, but we can manage it. We can make sure that it doesn't affect our body as it is, or if we let it. So the studies have shown that people facing stressful situation on a regular basis are more prone to microbial attacks and other immune compromised diseases. Anger stems from stress. People who are prone to anger are found to have increased NK cell activity, decreased autonomic activity, and increase in total leukocyte count, which is seen similar when a patient has any disease or allergy. Anger causes release in both adrenaline and noradrenaline, which shunts the blood flow to the vital organs, which are the important organs, and redirect it to the less vital organ for fight or flight. People who suppresses anger are also affected. How? They have decreased cell-mediated immunity, they have decreased blood monocyte, elevated eosinophil, and poor NK cell activity. Chronic suppression leads to coronary artery disease, Parkinson's disease, stroke, SLE, kidney disease, and cancer. These are all proven findings, proven studies. It's not that I'm just telling you. These are all proven findings. Emotionally, people who suppresses their anger are prone to internal criticism. They don't easily forget or forgive, and they develop hatred. Similar happens when there is depression, grief, heartbreak, or divorce. Whenever there is a stressful situation, cortisol level increases, which is our stress hormone, which causes increase in blood pressure, reduces mental performance, blood sugar fluctuates, there is thyroid suppression, cholesterol buildup, and obesity happens. So NK cell, which I'm talking about, are nothing but natural killer cells, which work to destroy the tumor cells that invades our body, as well as various bacteria and viruses. High level of NK cell are good for our immune system, but psychological stress on a daily basis reduces the NK cell activity, which makes our body more prone to these disease. Now, how belief and health are related. This is one of my very favorite topic, and it is related to multiple personality disorder. Now, we all know about multiple personality disorder and why multiple personality disorders are there. The person having multiple personality disorders is actually trying to protect himself or herself from the emotional trauma or the physical trauma that the person has been subjected to over many years. And it does and it is normally seen that the two personality or whatever personalities they have, they are different from each other. So a very good study was done by psychiatrist Bennett Braun in his book, where he's written The Treatment of Multiple Personality Disorder, where he described a case of a patient who had multiple personality. One personality was allergic to orange juice, whereas the other relishes the orange juice. The first personality used to show hives, which are small papules or small pimple like things that happens all over the body whenever orange juice was given to him. But the same used to disappear when the other personality was in forefront. So same body, same food, How is that there are two reactions, the same food product? So it can be inferred that even disorders like allergy are related to mental beliefs and are formed as a result of misperception of the reality as well as emotional trauma. We are well aware of the placebo effects in clinical trials and in many treatments. A mere touch of physician and the words of comfort from their lips are able to heal patient more than the medicines. A study was done by Dr. Bruce Mosley, where he he saw the effects of placebo in the patients of chronic knee pain who was given knee surgery as their only alternative, that their pain will go away only if they will have surgery. So he took these people and he took them to the operation theater. He did everything and gave them anesthesia, but he didn't perform the surgery. He told them that they are given the surgery, and the results, 80% of the people came back and they said that their pain is gone when they were not given the surgery. So similarly, now how homeopathy is related to all this, and now how I have found that homeopathy relates to positive psychology. Homeopathy believes in the same principle. Homeopathy believes in the principle where it cures not the disease but the patient overall. It works on the philosophy that every individual processes the information in different ways. So we cannot have one medicine for everything. If 4 people in a household has got sick, we will give them 4 different medicine, not the same medicine to 4 of them. Every patient who comes to a homeopath are asked a series of questions because that help us to uncover the true nature of the patient. Who is the patient? How is the patient? Through these layers of disease, actually, who is the patient before this disease came? Homeopathy takes into account various idiosyncrasies, hypochondria of the patient and select the remedy based on their overall constitution. Mental symptoms for us play a key role because homeopathy believes that disease is manifestation of patient's mind and thought, and we take a lot of time to elicit this symptom. It is not an easy task. Our homeopathy comes with a philosophical principle which was given to us by our founder Samuel Hahnemann, where he provided us with step-by-step approach on how to treat the patient, even how to take a case, how to talk to a patient, then how to analyze the case, and how to see the cure is happening. And if we are hitting some obstacle, then how to overcome those obstacles. The first principle in that book states that it is our mission. It is our mission to cure the patient, and not just physically, but mentally, emotionally, psychologically, and spiritually. Holism is a concept in homeopathy, which means affecting every part of us, body, mind, emotion, spirit, and everything. Holistic means cutting across all the body system, not following a specific and prefixed physiological pattern or pathways. Hahnemann suggested that it would be unholistic to say that a person has respiratory infection or localized skin condition, because even though they are valid remarks, they are diagnostically correct, but they are just labels and conveys nothing about the patient's entire problem. To be holistic, we have to let go of all the prejudice and all the preconception that we have about the patient or the disease manifestation. The vital force is a concept in homeopathy, which means innate self-healing power of the body. And same has been mentioned in ancient time, whether it's ancient medicine of archers, whether it's Paracelsus or von Helmont. The same concept is there in homeopathy. Health is natural and dynamic, harmonious attunement. It is a state of smoothly coordinated functioning and balance. Health by definition is state of whole organism, not just the physical body, but the whole organism, the whole person, mind, body, spirit, and not just the absence of disease. In homeopathy, disease is not separate thing from living being, but it is actually an alteration in the state of health, which expresses itself outside through the symptoms. When we see the symptom, we know that health is affected. We don't say it is a disease. We say that it is a disease individual. Cure is possible only by changing to healthy condition of the state of health of the disease individual. Medicine will not be able to cure if they do not have the power of altering man's state of health, which depends on sensation and functions. So I would like to say in the end that positive psychology, homeopathy has actually given me a different direction to heal my patient. And this journey is long, I know, but I'm ready to do this not only for my patient, but for myself, for my family, and everyone around. So at the end, I would like to say that shoo away all the darkness and negativity, welcome all that is bright and positive, eat, sing, and make merry. Life will be fun and fulfilling. Now, anybody who wants to connect with me, they can connect with me via my website and my Facebook. I am available online, and thank you so much for listening to me patiently. And I hope that I have given some good insights for this, and people actually think about, think about their emotions and their feelings, because it really affects the physical body. It really affects not only yourself, but people around you. So whatever you feel or whatever you do, think that it is affecting your body a lot. Thank you.